welcome to The Explainer. Today, we're taking a closer look at a medication that's probably tucked away in a lot of our medicine cabinets, loperamide. You almost definitely know it by its brand name, Imodium.
I mean, we've all been there, right? You take it and you feel a sense of relief. But have you ever stopped to wonder how it actually works? What's going on in there to stop the, well, you know. Understanding the science behind it is really the key to using it safely and effectively. Okay, so first things first, we have to talk about what we're really up against. And honestly, the biggest danger of diarrhea isn't just the discomfort or the inconvenience. The real enemy, the thing that can get serious fast, is dehydration. Your body is just flushing out tons of fluids and essential salts, and that's the part that can be genuinely dangerous.
Right, so that sounds pretty complicated. Let's just break that down into plain English. Loperamide is the active ingredient. Now, that word peripheral is super important. It basically means it works locally in your gut. It doesn't mess with your brain. And anti-motility agent, well, that's just a fancy pants way of saying it slows everything down.
So how exactly does loperamide manage to calm that storm? Well, it turns out it's a really clever and targeted process. Let's dive in.
So check this out. Think of your digestive system as a river that's just flowing way too fast. What loperamide does is pretty slick. It doesn't just build a giant concrete dam and stop everything cold. Instead, it finds these very specific receptors in the gut wall and basically tells them to just ease up a bit. It gently slows down that current, and that extra time, that's the whole ballgame. It gives your body the chance it desperately needs to reabsorb water and electrolytes, which is how things get back to normal.
Okay, so we've covered the science. Now, let's get into the practical side of things, the user's manual, if you will. Knowing how much to take and what to look out for is just as critical.
Now let's talk numbers, because this is important. Notice that the initial dose for an adult is the same whether you buy it over the counter or get it prescribed. But, and this is the key difference, look at the maximum amount you can take per day. For over the counter, it's 8 milligrams. For a prescription, it's double that. It's 16. That difference is a huge safety measure, and it's the #1 reason why you should never ever go over the dose listed on the box without talking to your doctor first.
And of course, like pretty much any medication, there are potential side effects. On the left, you've got the more common, milder stuff, things like constipation or cramps. Annoying, for sure, but not terrifying. But look over on the right. Those are the serious, though thankfully very rare, effects. We're talking bowel obstruction or even heart issues. And it's so important to understand that these are almost exclusively linked to overdose, to taking way too much. It just hammers home my sticking to that proper dosage is completely non-negotiable.
Okay, this next part is maybe the most crucial thing we'll talk about. Loperamide is a tool for a specific job, and sometimes it is absolutely the wrong tool. Knowing when not to use it is just as important as knowing how.
I want you to think of this list as your absolute stop signs. If you have a high fever or you see blood or mucus, that's your body telling you it's probably fighting a nasty infection. If you take loperamide then, it's like finding a burglar in your house and then locking all the doors so they can't escape. You're trapping the bad guys inside, which can actually make things a whole lot worse. And of course, it is an absolute hard no for any child under 2 years old.
And here's your safety net, the one number you have to remember: 48 hours. Loperamide is designed for short-term relief only. If you're not seeing improvement after 2 days, that's your cue to stop taking it and call a doctor. It's a sign that there's probably something else going on that this medicine isn't meant to treat.
You know, this quote really nails it. It puts everything into perspective. Loperamide is fantastic for managing the symptoms, but it's not the actual cure. The single most important part of your recovery is always going to be rehydration. You have to replace those fluids. Remember this. The pill helps you feel better, but water is what helps you get better.
So, at the end of the day, loperamide is a really powerful and useful tool when it's used the right way. By understanding how it works, what its limits are, and where the red flags are, you're empowered to make the smartest, safest choice for your health. And really, being an informed patient is the best medicine there is.